fun new ways to keep the spark alive in long-distance relationships. Then, what to do about the curve down there. Plus, why you really can't get an STI from gym equipment. That's next on Sex Talk.
Welcome to Sex Talk, where we will answer the questions you've always wanted to ask about sex and relationships. I'm Dr. Leah Janine, Associate Professor in the Department of Health and Human Performance at Nova Southeastern University. And joining me today is Sex Talk correspondent Derek Latta.
Thank you for having me.
Oh, yeah. Thank you for having me.
My pleasure. We're dressed the same way almost. That's good. We didn't plan this, people. We didn't plan this.
We did not.
Anyway, we get a lot of really cool questions on this show. And this particular one, you know, I've never run into it. And there's no question that we're not going to find the answer for. So here we go. What are the best toys for long-distance relationships? Toys for long-distance relationships.
Yeah, that's important, right? There are a lot of options. Advances in technology have made it easier for couples to stay connected in more ways than one. With the pandemic, we saw a surge in the development of remote-controlled sex toys, designed specifically to bridge the gap between partners. These toys are not just about pleasure. They're tools to help deepen emotional connections and keep the spark alive no matter the distance.
So it kind of shortens the gap or lessens the gap.
Yep.
Okay. What kind of toys are there that help this?
Well, the technology behind these has come a long way. Many of these devices are app controlled, allowing one partner to control the other's toy from anywhere in the world. This control can include adjusting vibration patterns, speeds, and intensities, making each unique and personalized. Some toys are designed to sync with a partner's corresponding device, creating a shared experience where both parties can feel each other's movements and responses. This synchronization can heighten the experience, making it feel as close to in person as possible.
So if you see somebody maybe in a cafe and they're just smiling and having a great time with themselves, perhaps that's what's going on.
It's like the When Harry Met Sally, I'll have what she's having.
There you go.
Thing.
Okay. Can you give us some examples of some of these toys?
There is the Loviness Max 2. It is waterproof with multiple speeds and vibrations. It is controlled through an app and lasts up to 3.5 hours. Then there is the Lilo Idea Wave. It can be used from up to 40 feet away through the Lilo app. It is a dual motor, vibrating, targeting the clitoris and G-spot. Some people might be into toys that attach to underwear, like the Satisfier's Sexy Secret. It's a discrete magnet vibrator that attaches to underwear and is controlled through an app. Another toy that couples might find fun is the Lovinessence Hush 2. This anal vibrator has customizable vibration patterns. There are other toys too, some for different partners, some that have warming sensations, and there are just a lot of options.
Yeah, let's circle back for a second because I'm sure people are trying to write this down. So there's a Loviness Max 2.
Yep, that's the anal one.
Oh, that was the first one. That's a waterproof with multi-speeds. I wrote everything down.
Oh,
vibrations.
okay.
The Lilo Ida Wave, and the Loviness Hush 2. So quiet when you use it. Nice. That's good.
I would presume so. I would presume that means quiet. I don't really know why it's a hush, but that's what I would guess.
Before I go to ask you the benefits of using these toys, you mentioned the G-spot.
Oh, yeah.
What is it and how do I find it?
Well, the G-spot is really kind of overdone. So it's just like, this is what these sites say, like the mysterious G-spot. But the reality is it's just like a different part of the clitoris, right? So it's just the inner part of the clitoris. People typically think of the clitoris as just the small outer part covered by the hood. The reality is the G-spot, it's not like a new part of the anatomy. Okay. It's just going to be the internal clitoris.
But it has the same sensitivity the clitoris has.
Well, yeah, or even more. It really just depends on the person. Some people only want the external stimuli and some people prefer the internal. But it's definitely not, the word G-spot, I'm not even really a big fan of because it just kind of assumes that like there's an actual spot there or a new part of the anatomy, and that's just
And G for great, the great spot. Okay.
Not really. It was for the person that initially invented it, even though it's not really a spot. Yeah.
Got it. So what are the benefits of these toys?
Well, they can be another way to connect with your partner. Plus, it is a good way to explore and experiment. With the long distance, it will require you to have better communication. You can talk about what you like, what doesn't feel good, and what you want to try to strengthen your connection and understanding of each other's desires.
And make sure you have spare batteries at home and keep that phone charged.
Yeah, that would be disappointing if you're in like
in the middle of the, especially the hush one. You know what's going on, like, so you know.
You're just like taking batteries out of the remote. Like, I'm really gonna finish.
Messes the mood.
Finish this out.
What a buzzkill. Okay. Our next question: how does having sex induce labor?
Well, there's quite a bit of research on the topic. Sure, sex might work, but it won't really cause a woman to go into labor if her body isn't ready. There was one study that found that women who were having sex after 36 weeks were delivering sooner than those who weren't. Plus, they were less likely to have a labor induction. And there are other studies that show the correlation between having sex and inducing labor.
Is there any research that shows that inducing labor it doesn't induce labor, the sex?
Yes, there were a few earlier studies that didn't show a positive correlation for having sex and inducing labor. One study looked at 200 women. Half of them had sex before delivery and half did not. And the results in that study were practically the same for both groups. There was a similar study with 47 women that had similar results.
Along the same thread, can sex cause the water to break?
It's possible that the water can break during sex, but sex wouldn't be the cause. And of course, if your water already broke, you wouldn't want to have sex because that could lead to an infection.
So maybe sex will help or maybe it won't, but regardless, what are some of the benefits of having sex during a healthy pregnancy?
Well, for a woman, sex might even feel better during pregnancy. The breast will become fuller and more sensitive. It also might be easier to achieve orgasms or even multiple orgasms. A woman will gain about 3 pounds of blood, and a lot of increased blood flow is happening down there, making more pleasurable sex possible. Sex also helps with a woman's health. It can strengthen the immune system. A few studies have shown that it helps with blood pressure. Other studies have shown a decreased risk of preeclampsia. Plus, it helps prepare you for childbirth and could even speed up the postpartum recovery. And when it comes to pregnancy, it's natural to think about what's best for the baby. It might even have you question whether or not sex is okay, or even exercise. One doctor explains how these concerns are mostly myths.
Pregnancy is surrounded by myths. Two big ones are that exercise and sex are bad for pregnant women.
Exercise has actually been known to improve pregnancy outcomes.
Mayo Clinic obstetrician and gynecologist Dr. Yvonne Butler-Toba recommends healthy pregnant women get moving, especially with cardiovascular exercises like walking or using elliptical machines. It helps keep weight down and it may help them feel better physically and mentally. Even running is okay. However,
we'd like patients to avoid exercises that might cause direct trauma to their abdomen.
So no horseback riding, scuba diving, or skydiving. Now, besides exercise, the myth about sex and pregnancy is also busted.
Sex and running are good.
For most normal pregnancies, sex is fine. So be sure to check with your healthcare provider to confirm you are having a healthy pregnancy.
Okay, let's take another question from a viewer. Can you get an STD from a toilet seat?
Right. Well, getting an STD from a toilet seat isn't really something you want to worry about. It would be almost impossible. It's mostly because the things that cause STDs, like viruses and bacteria, don't survive alone on surfaces like that. Plus, they don't survive outside of the body that long.
Yeah, there's so many false information out there, or maybe we're just naive or ignorant, but it's no problem.
I think people are just kind of making it up. If they catch an STD from frolicking around, they're like, definitely got it from a toilet seat.
Yeah, honey, I was sitting on the toilet,
right,
and that's
right.
why I got it.
It was absolutely, I actually knew a girl in college who claimed that she got an STD from a bike seat in a spinning class. And I, at the time, was the fitness director, so I was like really insulted. I'm like, we clean our bikes first off. And secondly, that's not even possible,
Right. So speaking of cleaning off, how about those toilet seat paper things that you can sit on? Is that, I mean...
Well, since you're unlikely to catch anything, it's really not gonna do much. But the practice of it isn't necessarily bad, and if it makes you feel better, go for it.
Yeah, peace of mind, and it can't hurt, right? Can't hurt. Anyway, next question, Dr. Leah. Is it normal for someone to feel aroused all the time? I ask this because I am disabled and I have CP.
Well, sexual arousal is natural. If you're feeling aroused constantly, especially without any apparent triggers, it might be confusing and cause problems. But backing up a bit, let's talk about CP, which stands for cerebral palsy. This is a neurological disorder that affects movement, muscle tone, and posture. It can also impact various aspects of a person's life, including sexual health. In a study of young adults with CP, 80% reported physical problems with sex related to their condition, while 45% experienced emotional inhibition that made it difficult to initiate sexual contact. But feeling aroused all of the time could be something like an arousal disorder, like persistent genital arousal disorder. Persistent
arousal disorder.
Persistent genital arousal disorder.
Oh, persistent genital, okay, I wrote it down wrong. Tell us more about that.
Well, it's rare and it's more commonly reported in women than men. Unlike other arousal disorders where individuals have trouble getting stimulated, PGAD involves constant and uncontrollable state of arousal. This can actually be incredibly frustrating, as these feelings can persist for hours, days, or even longer, often without relief from an orgasm.
You know, it sounds like a blessing, you know, I'm excited always, but also a curse. I mean, how do you diagnose it?
Well, arousal that lasts for hours, days, or longer and doesn't go away easily, or an arousal that doesn't end with orgasms, or an arousal that is intrusive or unwanted and isn't triggered by sexual activity, or if it causes you distress. If you're experiencing persistent arousal, it's important to talk to your healthcare provider. They will conduct a thorough evaluation, including a physical exam, a psychological assessment, and possibly tests to check hormone levels and blood flow to the genitals. Advanced imaging, such as an MRI or CT scan, may be used to look for neurological issues.
And what is the treatment? Is there one?
Typically, it would be to manage symptoms since the cause isn't clear, but some treatments that might help include anxiety treatment, ice baths, acupressure, muscle relaxants, but those are just a few examples.
Okay, let's take another question, Dr. Leah. How do vaginal dilators work? First of all, what are those?
Well, vaginal dilators are specialized medical devices shaped like small tubes that are designed to help women manage and overcome discomfort or pain related to vaginal penetration. These devices are particularly useful for women who experience conditions like vaginismus or vaginal atrophy, which can make sexual intercourse, tampon use, or even routine medical exams uncomfortable or painful.
Okay, I'm trying to wrap my head around this. How do they work?
The main goal of vaginal dilators is to help women gradually expand the tissues and relax the muscles around the vaginal opening. The process typically begins with the smallest dilator in the set, which is gently inserted into the vagina. As a woman becomes more comfortable, she can gain progress to larger dilators over time. This gradual approach allows the muscles to stretch and relax at a pace that feels comfortable, helping to reduce pain and anxiety associated with penetration. For women who are new to using vaginal dilators, it's important to start slowly and listen to your body. Often it's recommended that women practice controlling their pelvic floor muscles before using a dilator. This can be done through exercises or by inserting something small, like a finger, to gain confidence and control.
Dr. Leah, you mentioned vaginal atrophy. You know, what is it and how can you cure it? Or is it a cure?
Well, it's really just like any other muscular atrophy, right? And atrophy just meaning it's the weakening of the muscle. So if you're not having sex or if you're not stimulating an orgasm, so solo sex or coupled sex or doing anything like that, and you're not having contractions, then it's going to atrophy. And it can cause incontinence and a bunch of other issues. So maintaining regular sex, whether if it's with a partner or by yourself, can help prevent it.
So if you don't use it, you lose it, in a sense.
Exactly. Just like really any other muscle. You know, you stop working out for a couple years, you're not going to look as jacked as you were before.
That's true. We'll take our next question, Dr. Leah. When I have sex with my partner, he always slips out. How can I prevent this from happening?
Before diving into prevention tips, it's essential to understand why slipping out happens. Contrary to some myths, it's not solely about the size of the penis. Maybe it's the lubrication. While lubrication is crucial for comfortable sex, too much of it can make things a bit too slippery, increasing the chances of slipping out. Certain positions and movements can increase the likelihood of slipping out. For example, deep thrusts and positions where there's a lot of movement, like doggy style, can make it easier for the penis to slip out. And when both partners are moving their hips in different rhythms or directions, it can create a mismatch that leads to slipping out.
So what can be done about this?
Well, experiment with different positions. If you find that slipping out is common in a particular position, it may be worth trying others that allow for a more stable connection. Positions where the partners are closer together, such as spooning or missionary, can offer better control and less risk of slipping out. Adjusting your thrusting technique might also be an option. Shallow thrusts where the penis doesn't withdraw too far out can reduce the chances of slipping out. This technique helps movement controlled and minimizes the risk of losing connection.
Are there any tools that can help?
Well, you can look into incorporating pillows for support. Sometimes the angle can contribute to the issue. Using pillows to adjust your position can help find the optimal angle for both comfort and stability. And if you're using lubrication, maybe look into cutting back on how much you use to reduce that slipperiness.
The old cheese wedge pillow you talked about all the time.
Exactly. There you go.
Our next question, Dr. Leah. Is there an easy way to fix a curved penis?
Well, some degree of curvature is normal. If you've got a curvature of more than 30 degrees, you might want to consider speaking to your doctor. But even if your curvature is more than 30 degrees, treatment may not be necessary if it doesn't cause symptoms or interfere with sexual intercourse. However, if the condition is impacting your quality of life, it's crucial to seek help early, as treatment can take weeks or even months to show improvement.
And I'm trying to figure out, how do you figure out a 30-degree?
So actually, there's a couple ways. You can go into the doctor's office and have them measure, or you can simply take a protractor and measure, or you can take a picture, is probably the easiest one, and then you can measure a degree. So whenever you're trying to measure any degree, any range of movement or any degree movement, it's much easier when it's not 3D, if it's only 2D.
Okay.
Yeah, fun fact, actually, if you're trying to determine like the optimal angle of flexibility, a 2D image, so like an X-ray, is actually the gold standard, not any other device that you would use.
Okay, interesting. Can you remind us of some of the treatments?
Well, there are non-invasive and surgical options. There is the vacuum erection device that gently stretches the penis, which can help break down scar tissue and improve curvature. There are also medications. The only one approved by the FDA works by breaking down the collagen that makes up the plaque in the penis that's causing the curvature. And when the non-invasive options don't work, there are different surgery options.
Dr. Leah, any tips on how to deal with this, and when should they see a doctor?
Well, connect with the urologist. They can diagnose and treat the curvature if it is causing issues. And of course, talk to your partner about how it is affecting you. You might consider therapy to help with any challenges that this is causing. If the curvature is significant or it's new, you could have what's called Peyronie's disease. Let's take a look what this doctor has to say.
Peyronie's disease is a condition that can cause a lot of anxiety and discomfort, but it's more common than you might think. It happens when scar tissue, known as plaque, forms inside the penis, leading to curved, painful erections.
Peyronie's disease hits them during their most active phase of life, when they're 40 to 50 years of age. So the majority of my patients are young, they're sexually active, they have no other problems with erection other than the curvature.
Trauma to the penis, like an injury during sex or sports, can also trigger the formation of scar tissue. Conditions like diabetes and high blood pressure, which affect blood flow, may also contribute to its development. If you're noticing any symptoms, don't hesitate to talk to a doctor.
You know, Dr. Leah, it seems really important to just get checked out, because if you don't, the condition can worsen.
Yeah,
serious.
Absolutely. As always, you want to go back and talk to your doctor about it. And it's especially bad if it were a result of like a traumatic injury that happened during sex. Then you definitely want to go see your doctor, even if it's not at 30 degrees.
Oh, a tremendous injury during sex.
Yeah. Oh no. It can. I've actually read a story.
I'm sure you have a friend.
No, it's not a friend. I actually read a story. They decided, they ended up in the ER, but the guy decided it would be a good idea to like jump in as opposed, and obviously hit the pubic bone, which caused curvature. If it's a result of an injury as opposed to being born with it, definitely go see a doctor.
Got it. Next question, Dr. Leah. How can tribulus help with sexual functioning?
This is a plant traditionally used as an aphrodisiac in various cultures and European folk medicine. It has a reputation for enhancing sexual function, and it's been made popular for those looking to improve their libido and overall sexual health. The main bioactive ingredient in Tribulus is something called prodidiocin, and this is thought to increase levels of certain sex hormones, including testosterone, which could explain its reputed benefits for libido and sexual performance.
You know, there's a lot of kind of misinformation or skepticism about herbs and supplements and whatnot. What kind of research has been done on Tribulus?
Well, there has been some research on how it might impact male fertility, particularly in terms of sperm count, motility, and viability. Some animal studies have shown that Tribulus can increase testosterone levels and improve nitric oxide synthesis, which could enhance sexual function. However, these results have not always been replicated in human studies. Older studies reported significant improvements in ejaculate volume, sperm concentration, and motile sperm, along with better conception rates. Even though the results were promising, those studies were poorly designed. A lot of the more recent studies are mixed.
So tell us about these recent studies, because the old ones, like you said, who knows, right? So these
and you always
ones,
have to be cautious, especially with animal studies. They don't always translate into humans, obviously.
Absolutely.
Right? Some studies have shown that adding Tribulus can enhance motility and viability, but a trial with 30 men who were infertile found that no improvements. And another trial did find that sperm count and motility improvements, but not with the size and the shape of the sperm.
Tribulus, I've kind of first time I've been hearing about this, and I'm kind of, I'm well read about these things and supplements. It's kind of new, right? This Tribulus?
It's not really all that new, but it's like anything else. Like maca's been around for 2,000 years, but now everyone loves it for, improving sexual enhancement. So I wouldn't say that it's that new. I think it's just gaining more popularity. But one of the things that's interesting about these supplements, and again, always check with your doctor, but they can be used in combination with prescription drugs like Viagra, Levitra, Cialis. And so the combination effect or the synergistic effect has been shown some great results. But again, always want to talk with your doctor to see what can be combined and how.
Right, okay. Always check with your doctor first before doing anything. Okay, thank you, Dr. Leah. Our next question. What happens to testosterone during and after sex?
As you probably know, testosterone is an important hormone in the body, especially when it comes to sex. Testosterone affects muscle size, bone growth, sex drive, and sperm production. And there are some studies that looked at how testosterone levels fluctuate with sexual activity. One study collected blood samples during different stages, like those before an erection, at ejaculation, and so on. The study concluded that testosterone levels increase during sexual activity, peaking at ejaculation, and then gradually return afterward.
I'm trying to wrap my head around how do you get a blood sample during an ejaculation?
Well, some types of studies examined people that were masturbating. Others examined full intercourse. For instance, a study conducted in a sex club compared testosterone levels in men who participated in sexual activity versus those who only observed. The results showed that while testosterone levels increased in both groups, the increase was significantly higher in those who were sexually active. Another study looked at testosterone levels in men and women before and after intercourse. The findings were similar. Testosterone levels were highest after sex, suggesting that the sexual activity itself drives the increase in the hormone rather than the other way around.
So a good way to avoid testosterone therapy is just to have more sex.
Hey, why not? And it also helps increase your desire for sex. People always say, I'm not really having sex, I don't have a desire. If you start having sex, you'll want more sex.
Our last question of the day, Dr. Leah. Why am I experiencing pain after I ejaculate?
Ejaculation occurs in two stages, emission and expulsion. During emission, semen is created by combining fluids from the prostate, seminal vesicles, and vas deferens. Expulsion is the phase where the pelvic floor muscles contract to propel the semen through the urethra and out the penis. If these muscles are not functioning, they can cause pain during this process. For muscles to work efficiently and without pain, they need to move through their full range of motion, contracting and relaxing as needed. When the pelvic floor muscles are chronically tight or held in a contracted position, this can lead to discomfort and pain during ejaculation. So it could be a pelvic floor issue.
So what are some of the symptoms that they might have?
Pelvic floor dysfunction can lead to bladder symptoms like having the urge to go all the time, incontinence, and poor urine stream. There might also be bowel symptoms like constipation, hemorrhoids, fissures, or diarrhea. Sexual symptoms can include ED, premature ejaculation, or reduced ejaculatory strength. And then someone might also experience numbness or other sensory changes in the groin, thigh, genitals, lower abdomen, and back.
$64,000 question. Is it treatable?
Well, you can treat pelvic floor dysfunction and you can prevent it. Consider seeing a specialist, such as a pelvic health physical therapist, who can provide a thorough evaluation and develop a personalized treatment plan. This may include internal manual therapy, neuromuscular retraining, and exercises to manage symptoms and improve muscle function.
You know, it's a miracle you didn't recommend Kegel exercises.
I think I've recommended those enough.
I think that's your middle name. What else could it be?
It could be prostatitis, which is an inflammatory condition. While someone with this might have painful ejaculation, they might also have painful urination. Well, Derek, this was another great show. I loved answering these viewers' questions. We're all out of time, but we will see you next time on our Sex Talk program, where we answer the questions you've always wanted to ask.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about Sex Talk. Go to AskDrLeah.com.